Good evening. How's everyone feeling this evening? Well, I'm so excited to be here and to share with you the health challenge. We can put the first slide. Did you know that half of the world is unable to access essential health services? Think about that. 1 out of every 2 people in the world do not have the health care that they need. 1 out of 2 babies born do not have a chance to a healthy life. I was born and raised in Zimbabwe, and my first 18 years were relatively uneventful in terms of health. I feel like at the time when I grew up in Zimbabwe, the country had a stable health system and relatively accessible health services. I moved to the United States in 1996. I was 18 at the time. By now, you figured out how old I am, I guess. And I arrived at Dulles Airport in Virginia to snow everywhere. It was in the middle of the blizzard of 1996, and I kept thinking, are we really in America? Not the America I'd seen on TV. It was only until a few months later when I visited New York City that I said, okay, I'm in America, yes. But I digress. So I wanted to share with you, after a couple of years in America, I was studying in university. I got that dreaded phone call from Zimbabwe. And the phone call was letting me know that my brother, who was 2 years older than me, had been involved in a car accident. He was a student at Rhodes University, which is in South Africa, neighboring country. And he was on the road to go back to school, headed to law school. And he was in this accident in the middle of virtually nowhere, very small town. Closest clinic was 30 kilometers away. No ambulance to take him to the clinic. He was transported to the clinic. We asked what's wrong with him. They said, we really don't know. He doesn't have visible injuries, but he's in and out of consciousness, and he's in a lot of pain. Unfortunately, it's in the middle of the night. There's no doctor on call. We don't have any emergency equipment in order to check to see what's wrong with him, so we'll just wait until the morning. In the meantime, we'll give him painkillers. I was devastated, thinking, man, if he was in the US, they would probably have an ambulance. He would have been taken to an emergency hospital. They would have checked by now, and we would know, and they'd be treating him. Needless to say, he didn't make it till the next morning. 6 hours later, he passed away. I got a phone call again to say, he's no more. I was devastated because I'm thinking, I'm here in the US where I have access to the best health system in the world, and my brother is in Zimbabwe, and they could not save his life. That was a tough experience. Fast forward a few years later, I got married, had kids, graduated, was working, and decided it was time to start a family. So I had a pretty decent pregnancy and went into the hospital to deliver the baby. I was in Bethlehem, Pennsylvania, the Lehigh Valley. I know someone who said they're familiar with the Lehigh Valley. Yay! Earlier. Oh, great, a few more. So I was at St. Luke's Hospital in the Lehigh Valley, and I thought, great, I don't want any epidural. I'm a strong African woman, wide childbearing hips. I'm going to do this. Go into the hospital, I go into labor. After about 8 to 9 hours of labor, I was 10 centimeters dilated, but the baby did not descend into the birth canal. They said, despite your childbearing hips, your birth canal is too narrow for that baby to come out, so we will need to perform an emergency C-section. I did hear the doctor whisper to my husband, it's not looking good. I was scared, I was terrified, but at the same time, I had the comfort of knowing that there was the convenience of all the medical equipment, great doctors, and everything that was needed. And if they could save myself and the baby, they would do it. I couldn't help but wonder, if I was in Zimbabwe, 1, would I have survived? 2, would the baby have survived? So the baby was born. He did have breathing complications, so he went into the NICU, and he was there for about a week. He's now 11 years old, big, strong boy. But also, I wondered to myself, what about the woman in rural Gokwe, who is about maybe 30 kilometers away from the nearest clinic? They have to walk for those 30 kilometers, maybe around their 8th month, to go and live at the hospital in a waiting mother's shelter, waiting to deliver the baby. If there are complications and they do not have emergency equipment, Will they be able to do an emergency cesarean section? If it's in the middle of the night and the doctor is maybe another 60 kilometers away, what will happen to that child? All of those thoughts nagged me. And then fast forward a few more years, we decided, after being in America for 17 years, husband and 3 kids in tow, let's move back to Zimbabwe. Great, we were very excited. It was time to introduce our young children to the lifestyle and the culture and everything that we had grown up in. Biggest fear was not even how will they assimilate, what will the education be like, how will they feel. Our biggest fear moving back to Zimbabwe, to be honest with you, was the medical situation. Our middle son was asthmatic. All 3 kids were allergic to pretty much everything under the planet, including chocolate and ice cream. So we wondered, if there was a medical emergency, would the children survive and thrive? But we took the risk nevertheless and went back to Zimbabwe. The reason I'm sharing this information with you is because the statistics that are out there show you that back in 2008, 65% of healthcare services in Zimbabwe were provided by the public sector. But since then, there have been challenges, an unprecedented deterioration of the healthcare infrastructure, a loss of experience of health sector personnel, as well as drastic decline in the quality of health services. I don't know if you know this or if you're aware of this, but in the US, there are 26 physicians per 10,000 people. In Zimbabwe, 1.6, so really 1 physician for every 10,000 people. In Zimbabwe, there are 2.7 nurses per 10,000 people, whereas in the US, give or take, there are 86 nurses per 10,000 people. And these statistics are from the World Health Organization. So we met with the Ministry of Health when I was in Zimbabwe, and they said that there are 63 district hospitals in the country, and there are 48,000 deliveries per year in these hospitals. So we asked them, what is it that the hospitals need? What are the needs of these hospitals? And you can see the list and this list is not even exhaustive. We're talking about ambulances, drugs, resuscitation equipment, incubators, even the consumables that you use, the gloves, the scissors, every little thing that's needed. Fetal monitors, ventilators. The list, again, is not exhaustive. And there are 4 radiation machines at Nyatwa Hospital, which is the biggest hospital in Zimbabwe in the capital city. And then there's Bulawayo, which is the 2nd largest city, that has 3 machines at Mpilo Hospital for radiation. I asked recently, actually as recently as yesterday, I said, are the machines working? And they said, give or take, you just don't know going in because of lack of service sometimes, as well as power outages and so many other issues. But what if we could change that? What if we could give every mother and every single baby born a chance to live a healthy life? What if we could tell them that they matter and that their life is worth it? I strongly believe that the work that is being done by organizations like Matter and other local partners in assisting Zimbabwe and other African countries to mobilize equipment and life-saving commodities is critical to access to health services in Africa. The great news is that with Matter's solutions and the resources that they have, bringing together some of the best hospitals and partners right here in Minnesota, we can change that. We can make sure that no mother has to give birth, like Quentin said earlier, on the floor again. We can make sure that the doctors have tools that they need to care for people with dignity. We can tell people that they matter. We can save lives. I really would like to take this opportunity to thank Matter and the local partners as well as international partners for investing in Zimbabwe and for the work that they've done. I've personally witnessed, I was with them when they opened up the Victoria Falls Clinic where they donated equipment, and I saw the faces of the mothers, the doctors, and everybody who was there. Alongside the clinic, they had the nutrition garden as well. So in terms of the impact of this help that all of you together are bringing, I have seen it firsthand, and I've heard the testimonials of the people on the ground. We know that no one has all the resources, and no one even has all the solutions, nor all the opportunities. But the work that you all, I should say, and instead of saying they, but the work that you all are doing in Zimbabwe is making a huge difference in the health, livelihood, and well-being of the Zimbabwean people. And as Matter likes to say, you don't have to be a charity to change the world. For the sake of my people in Zimbabwe, for the sake of the people around the world right now, right here, and in Minnesota, let's change the world tonight. Thank you. Tunotenda, siyabonga, twalumba loko, merci beaucoup, gracias, and I think that's all the languages I know.